Good afternoon once again. Crowd is a lot thinner than we would like it to be. I'm assuming more people are going to watch us and join us very, very shortly. Deepak Sani, it's an interesting conversation to have at this point because we've already spoken to some great leaders in health sector in the past couple of hours. And a lot of prognosis, if I may use a word from the healthcare sector, has come in by the way of what we are doing right, what we are doing wrong as far as our health is concerned. I want to understand from you, having been in the industry for as long as you have, run us through some of the key trends and changes that you have seen as a founder of Healthian.
Sure, thank you for having me here. I think you've rightly said, actually the healthcare scenario in India has been changing ever drastically, and there is a pre-COVID and post-COVID scenario which has changed a lot of stuff. So there has been amazing trends. I will talk about one trend in terms of what I see when we see how people are reacting to health issues. And I will also talk about some trends that probably our data speaks today, right? So trend, when you really look at, I think people are getting more and more aware. I think post-COVID, everybody is fearful of dying. So that is why everybody wants to check everything, and that's the reason. And we see this very much near to us, because if you go 10 years back or 7 years back, there was nothing called a green tea that used to exist, right? Today you can't survive without that because you know everybody is using it. There are a lot of fads and a lot of trends have also emerged over a time because people are becoming aware, right? So what you see around yourself is actually more driven through awareness than a real fact. But that shows you, because every table that I go to and talk to, there's someone talking about health, talking about resolution, talking about wearables, talking about...
Too much for that matter.
Yeah, so talking about going to a gym or maybe some sort of a diet, from a keto to 9 types of diet. So all of this shows that actually the people are becoming aware, which is good for the country, right? Because when you are self-aware, that's the best thing that can happen to any of the country, because people are taking care of themselves. But in what direction is that question? Now, when it comes to real trends, at the same time, the burden of disease is also increasing, is what we see. So while people are becoming aware, we are also seeing there is a huge disease burden also coming in. So for an example, just a simple cancer testing, right? So in a preventive way, when we started in 2014-15, there used to be only 1% people who used to take a cancer test as a prevention, right? Today we see a whopping 9% taking cancer test as preventive.
Out of every 100 people who use your services, 9% are taking a cancer test.
So I'm saying these are like screening and a marker test, which means people are so worried because they know it is all around them. 10 years back, we used to know that I know somebody who had a cancer in their family. Today we say,
I know someone.
Yeah, or my family has a cancer.
Right.
Somebody very near. So that's so, the thing that was so away from you is now just sitting in your home. And that is why people are much more aware, and that's being seen. So one side, awareness is increasing really, really high, but at the same time, the disease burden is also rightly increasing.
And you know, we were speaking right before this session, and you told me something very interesting. You said you have enough data collected from Haryana and Gurugram itself in particular that can tell you what are the kind of problems that people face. Run us through some of these trends that you have collected by the way of data that has come about from people using your platform. What are the key issues that people are facing? Are these lifestyle diseases? Are these diseases that are inherent in nature? What are the problems that today people are facing in general?
Sure. So we looked at, so what I'm talking about the data is basically in millions. So we don't do a small research of 1,000, 2,000 people. I'm talking about millions of
people.
And tracking that data over the number of 6 to 7 years on an average, right? So we see very different sort of a trend. When I talk about these trends, largely, if I talk about specifically Gurgaon, I think all around India, this is a deficiency of vitamin D, which is the highest issue in deficiency, which does not impact much, but it impacts in your bones and a lot of, this is as high as 78%.
78%. So you're saying out of all the people sitting here, more than two-thirds have a vitamin D deficiency. I think that's a good food for thought. Please get your vitamin D checked. Many of us are vitamin D deficient in this country.
If they're not taking supplements, I'm 100% sure They are really the deficiency. Even in kids have 9 years, 10 years, 12 years. We've been seeing this because nobody goes out in sun today, and there's a lot of other reasons for that. Second number here in Gurgaon is what we are seeing is saw a trend before COVID, which is more about fatty liver, and today we see this particular going towards a liver disease route. We are still finding out reason. One reason definitely is easy access to alcohol in Gurgaon, for sure.
Okay.
And also
so that is resulting in liver issues.
So because we see a lot of people as high as 28-29% have elevated GGTs, SGOTs, and stuff like that in Gurgaon, which is basically a cause of a liver concern. And I see this becoming a real chronic issue in times to come. Now the reason
another food for thought: cut down your alcohol levels.
Absolutely. Or probably it has to be a sensible sort of a thing then, because you can't cut down on alcohol, but you have to be sensibly there, because people, there are many countries in the world which have higher alcohol consumption than what India has, right? But they don't have this disease because they don't mix food with alcohol, which we do a lot. So there has to be a way you see the things. That is why that is needed. Third thing, a biggest trend that I'm seeing, which is the worrying trend all over India and largely in Haryana also, is there's a lot of deficiencies of hemoglobin. There's a lot of deficiency of iron serum, which is coming in people these days. Now, we say why this is happening and we've started finding out, and there are many reasons. One, obviously, is the lifestyle. Second is the environment, which is the pollution. Third is everything else that we do is adding up to the inflammation in the body, because of which, again, the absorption of iron and absorption of blood is not happening the way it used to happen. Fourth is we have changed a lot of diet, specifically in urbanic towns like these. We used to have a lot of pulses, a lot of iron-rich foods, and a lot of this thing, which is now been by the fads has completely converted into something, right? People are putting coconut oil in a black coffee to drink in the morning. That's the first thing that people are doing to weight loss.
Is that good or bad?
You're actually changing everything what you have done from last 20, 30 years, right? And that won't suit your body today, right? So your pulses have been completely changed to quinoas and all other stuff. So your iron diet has got changed and your lifestyle hasn't changed that much. So all of this is not creating anything in a right figure, because when you see this trend in 7-8 years, you will see these trends reversing. Okay. Because they're not right for the body.
Okay,
right?
Amazing. Thank you very much for that. I think a lot there that came by the way of how to keep ourselves healthy. We did a poll in our last session. We were discussing healthcare, and I asked people to raise their hands if they've gone through a full body checkup in last 1 year. The number of hands raised weren't too many, and not as many as I would want them to be. But once again, quickly, how many of you had not health checkup before you raise your hand? How many of you been hospitalized in last 1 year? Hospitalized? No? How many of you been to hospital due to whatever minor sickness, lifestyle disease, diabetes, etc., etc.? Nobody? No? Oh, that's a group of very healthy people there. But coming back to our conversation, particularly with respect to Healthian, where you would be going next, I know you said you will be expanding geographies and you're looking into catering to more market, perhaps tier 2, tier 3 cities beyond metro cities. Run us through your expansion plans.
Sure. So currently, as a service, we are in about 250 cities across India, which covers up all the metros, tier 1s and tier 2s. The challenge with tier 3 definitely is that you need to be near to the patient, and sometimes the population size in those particular cities are too small to have a lab there. But we are bringing in smaller mobile units and smaller setups to reach to that tier 3 level cities as well. Further, we are also going down. So supposedly in a Delhi NCR, we used to have 2 labs. We're building 3 more labs there, because we need to be, now everything is becoming quick commerce, right? So you need everything quick. And that's why today people also need results quick. The moment you give a blood test, you are in anxiety and you want to have a results quick, which probably means that you need to have a lab near to a patient, and you probably need a result in about 4 hours or 6 hours. So we are also expanding in that way. Wherever we see there is a demand and there is somebody who's really looking at taking a decision the same day, show it to the doctor in the morning and take a decision in the evening, have a clear diagnosis. That requires more labs to coming in. So we are also expanding within the same cities and going more deeper, basis the demand from people.
Okay. And before I wind up, I'm running out of time. want to understand from you, since we are discussing the role of AI and technology and how that's going to change healthcare sector, in your assessment, what sort of integration have you made of AI and machine learning at Healthian, and what sort of changes are we looking at going ahead? Faster services, better services, what's going to change?
Sure, I think this is a very integrated part of, because Healthians, whatever it is because of the entire backend and the tech that it has developed over years. And that's why we expanded at least 5x faster than any other diagnostic business. So in 2015 itself, we introduced the first level of algorithm-based AI was not there at that point of time, a smart report. Today, from the last 2-3 years, there has been over 15-16 modules, which is completely based on AI. And that is becoming that is giving us sort of good trends, analytics, and insights into your own health as well. So I just want to tell you, for every Healthians report, whenever you get a next report, your all past data of the last 10 years is there in that. So you don't need to carry multiple reports. You carry your current report, it has last 10 years data. Now we combine that 10 years data and make a page for a doctor also. So he doesn't have to go that 40 pages. He can see one page and can make out how your trending has been going on. So for a healthy person, he can make out that his weight has been increasing and simultaneously his sugar has been increasing. And this is the main reason because of this is happening. So we do that partial diagnosis for him through AI.
Okay.
Right? Plus, we also do a recommendation. So you gave a test, some results have come, so you can see your results live. But within that test results, we can tell you, because this is coming high, you should also check this.
Okay.
So rather than you've been giving a blood twice or thrice to find a final diagnosis, the system will automatically keep telling you, oh, your blood sugar is high, you should also check HbA1c the last 3 months. Because these diseases are also high, you should also check your KFT.
Brilliant.
So you can even order them there and then.
Right.
So like these, there have been immense number of AI use cases specifically about your own predictive health, wherein today, like last day itself, we have launched a feature wherein your report will be explained to you in a video format within 5 minutes, better than probably going to any friend or a chemist or something else, like a physician will tell you, and explain each and every parameter to you in a video format. So if it's a liver problem, it will show you how the liver is, where the problem is, and what we are saying is high and low. So
wonderful,
you can understand that.
Wonderful. So you're not getting not only getting better analysis, you're getting faster results, and you're getting more accurate analysis of what's really wrong there, and 3D imaging to faster results at your home. I think AI is going to transform healthcare sector. Deepak, thank you very much for taking time out. Thank you for joining us
Thank you. Thank you guys.
today. Lovely hearing from you. Thank you.